So I'm a 65-year-old female. My father had Parkinson's. I've recently been diagnosed with Parkinson's, and I'm having a meeting today with my doctor.
Hi, my name is Katie. I'm
Hi.
your doctor today.
Hi, nice to meet you. I'm Megan.
I see that you've been recently diagnosed with Parkinson's disease. You must have a lot of questions. How can I help?
I do have a ton of questions, so can we just start with the simple breakdown of the disease?
Absolutely. So basically, Parkinson's is a neurodegenerative disease. Body movement is controlled by dopamine, a chemical that carries out signals between nerves and the brain. When cells that produce dopamine die, the symptoms of Parkinson's appear.
So what kind of symptoms should I expect?
You can expect tremor, rigidity, or bradykinesia, which is just the slowness of movement.
How will these all affect my body?
So tremor will be the most noticeable, and it affects the hands, feet, head, neck, face, lips, jaw, and tongue. It's characterized by rhythmic, alternating flexion and contraction movements.
So what is rigidity?
Rigidity is defined as resistance to movement of both flexors and extensors. It involves jerky, cogwheel type, or ratchet-like movements that requires a lot of energy to perform.
What is bradykinesia?
Bradykinesia is the slowness in initiating and performing movements and difficulties with sudden movements. Unconscious, associative movements occur in a series of disconnected steps. This is the most disabling of the symptoms.
So since the disease is degenerative, that means it progressively gets worse, right?
Yes, it's a chronic disease with no cure.
Okay, so what can I expect in the advanced stages?
You can expect falls, loss of postural reflexes, emotional and voluntary facial movements are limited, loss of blinking reflex, the tongue, palate, and throat become rigid, and speech becomes slow and monotonous. The basal ganglia also influences the autonomic nervous system, so patients often have excessive and uncontrolled sweating, sebaceous gland secretion, and salivation. Lacrimation, dysphagia, orthostatic hypotension, thermoregulation, constipation, impotence, and urinary incontinence are all also present.
Okay, that's a lot of symptoms, but what about my cognitive function? Will my mind still be okay?
Cognitive dysfunction can occur in about 20% of patients. This could be evidenced by difficulty in planning, starting, and carrying out tasks.
Okay, so what exactly is happening to my body that is making these symptoms occur?
Okay, so the degeneration of the nigrostriatal pathway and the reduction in striatal concentrations of dopamine neurons in the basal ganglia. This comes from a genetic mutation in the alpha-synuclein protein. This protein changes shapes and clumps, creating Lewy bodies, which causes the dopamine neuron to die. Without normal amounts of dopamine, homeostasis is affected and the symptoms of Parkinson's arise.
Okay, so what is the basal ganglia?
So the basal ganglia is a group of interrelated subcortical nuclei that play an essential role in the control of movement. So that's just right here.
Alright, so what is the alpha-synuclein?
The alpha-synuclein is a protein abundant in the human brain. It interacts with phospholipids and proteins. It plays an important role in maintaining the supply of synaptic vessels and presynaptic terminals. It also helps to regulate the release of dopamine, which is critical for controlling voluntary and involuntary movements. So this right here is the alpha-synuclein protein.
Okay, and what are the Lewy bodies?
Lewy bodies, as seen here, are abnormal aggregations of the proteins that develop inside the nerve cells.
Okay, this is so much information, but I think I understand how Parkinson affects the body physiologically.
Okay, so we'll meet tomorrow to talk about what we're going to do for treatment of this disease for you.
Okay, perfect.